Hi, Mary. Welcome back. I'm glad that you were able to keep your appointment. And I just wanted to remind you, you're okay with our consent form?
Yes, I am.
Yeah, that's good. So, if I could just go back from our last time that we talked when we met and just kind of recap a little bit what I remember hearing you say that on our last visit, we talked about how you were very concerned that you were not able to get your exercise in and that really concerned you about your health issues that you're having along with your age, and that you were not able to get a doctor's appointment to be able to see a doctor with some of the conditions and concerns that you're having due to our national crisis that we're having. So, if I could just hear a little bit about today, about maybe, if a follow up of what you want to share out, if that would be okay. And what are some of the things that you've done since we last met?
Well, Miss Lovett, I am happy to see you again today. However, my concerns about my health, my age, and the situation that we're in with the coronavirus, and the doctors are not seeing any patients. I was very upset today because I have, or had rather, an appointment for May the 4th to see a neurologist. And I got a call from her office today stating that she would not be able to see me and wanted to reschedule me. So all of that kind of situations with not being able to see a doctor, and I'm trying to doctor on myself, reading information on Google, I am still confused. However, Miss Lovett, I want you to know, when we spoke last, you told me that I could exercise by going up and down my stair steps to the basement. There are 13 steps. So that has helped. You told me that I could go outside and walk around the block or up and down the sidewalk near my house.
And did you try that?
Well, I have tried that.
And how was that, Mary?
Well, I guess it is helping me as far as exercising is concerned. But like I said, Miss Lovett, I am 84 and a half years old. I will be 85 November the 22nd, 1935.
Okay.
And when I walk, my knees ache so bad. I just feel weak all over.
Okay.
I looked up some information on Google, and it sounds like to me that I have lost so much bone that I have something called osteopenia.
Sure.
And Miss Lovett, Google told me that osteopenia is the stage before osteoporosis.
Okay.
And I'm very concerned about that because this has never happened to me. But with walking, it's rendering me very, very weak. And I can't doctor on myself. And that's another reason that I am so upset. I was seeing a family practitioner.
Okay.
Since my children were 9 years old. Miss Lovett, my children are going to be 50-something, 52 years old on their birthday.
Okay.
I started seeing this family practitioner when they were 9 years old. And last year, I went to her and she took me off of my gout medicine. She took me off of my high blood pressure medicine. She took me off of everything that I was taking and said, I'll see you in a year. I said, a year?
Okay.
And she said, well, yes, a year. She said, if you need me, you got my number. So now, Miss Lovett, that's why you go to a doctor, because you cannot doctor on yourself.
Okay.
Is that right?
Okay, well, I would agree. However, I don't want to misinform you of any information. I think that, your concern, if I'm hearing you correctly, your concern is that you're not able to see your physician, or you're not able to see your doctor, and it has been a doctor that you have had for over 30 plus years, and you want to be able to get a medical response of an expertise of a diagnosis, and not you being your self-doctor. Is that correct? Or self-medicating or self-researching for yourself?
Well, yes, Miss Lovett, that is what I'm speaking about.
Okay.
So I was angered.
Sure.
And then I was going on a trip. And I called this doctor's office and spoke with her assistant,
Okay.
who's a nurse. And I told her that I was going on a trip, and it was during the pandemic. It was March, the early part of March, maybe around March the 1st. And I told the receptionist, the nurse, that I wanted to speak with the doctor because I had planned this trip, and I wanted to know if I should go and if there was any medication or shots or anything that I should take. Because the trip, Miss Lovett, was to Morocco, Africa.
Okay.
And I didn't get a response. And I called again with the same request. I still didn't get a response.
So how did that make you feel? Maybe because you didn't get the response and you were going, maybe you said you were traveling out of the country. Is that correct?
That is correct.
Okay, and so because you called prior to you leaving, and was this your same doctor that you've had for over 30 years?
This
30
was my same doctor that told me to see her in a year. Well, after they didn't respond, listening to friends and 22 or 3 other people that was going on the trip, we left on March the 11th, and we ended up in Morocco, Africa.
Okay.
I took precautions. I wore my mask. I had Clorox wipes, and we wiped down the table trays and everything on the airline.
Okay.
Went to Morocco, Africa. We were there 4 days. And then we got a call from our tour guide in Africa that said, pack your bags, have them outside of your door by a certain time. They're closing down the borders. And we're going to have to leave. We have to go to the airport in Casablanca. So we got ready, and we got on the bus and went to Casablanca. We got on a plane in Casablanca. We didn't have a flight plan because we were supposed to be there until Wednesday. We made it to Casablanca, got on a plane, Miss Lovett. We made it to we made it to Paris.
Oh.
And after we got to Paris, we stood in line on a flight standby for about 6.5 or 7 hours.
Okay.
Then we could not get a flight out. And the Air France airline, oh my Lord, put us in a hotel or motel in Paris for the night. We had to get up and go back to the airport the next morning. And I didn't order wheelchair service. And Miss Lovett, I want you to know that the gate seemed like it was 2 miles away. And while walking and rushing, trying to get to the gate to board the plane, my knees just gave out on me. And that is why, Miss Lovett, I feel like I have bone density loss, osteopenia, and I can't see a doctor. So then I saw a wheelchair driver, Ursha, that didn't have a patient. And I called him and said, "Sir, can you get me to my gate?" He says, "I'm on another call." I started counting my money. And when I pulled out 6 or 7 $1 bills, he said, "Okay, get in the chair." And he rushed me back to the departing gate just in time. So I made it home the next day, came through the airport in Chicago, Illinois, and had to go on a 14-day quarantine. So I went on that, Miss Lovett, and no symptoms, so thank God I was safe. Now I'm waiting, and all of my appointments are being canceled. I can't see the neurologist. I've had a cancellation for the orthopedic doctor. I have called and tried to talk to the orthopedic doctor via telephone. The receptionist hung up the phone and never called me back. And Miss Lovett, I just don't know what to do. Like I said, I can't doctor on myself.
Okay.
And I need help with my medical, physical condition. And I just don't know what to do. So I know I'm full of anxiety. I'm nervous.
Yes.
And I just need some help.
Right. Yeah. And I understand maybe some of your concerns are elevated more so than others. And so what you could try to do and to think about, okay, you have a level of anxiety. I want you to think about using a scale. And, you know, sometimes we can use a scale to find out the weight of something. We could possibly use a scale maybe if we wanted to find out how we're feeling about something, like maybe where our emotions might be. And I want you to just picture in your mind using a scale. And here's this scale from a 1 to 10. That would be our range, where there would be the 1 would be the lowest, and that would be the lowest number of how you're possibly feeling with this anxiety. And then from the 10 up to a 10 would be how more positive. So 1 being on the negative end, and the 10 being more to the closer to the positive or the better release of the anxiety. And so from what you have shared today, Mary, I want you to use that scale from a 1 to 10 and tell me on a scale, because I heard everything that you said. You got anxiety. You're concerned about your doctor issues. You're not able to see your doctor. You've had a lot of doctor cancellations. Also, you just come back from your trip and you went abroad and you did have to quarantine for 14 days. All of those are your concerns. But I want you to think about that since you have so many, I want you to think about prioritizing maybe one of those issues that you are experiencing or that you're having. And I want you to put it on a scale of 1 to 10. Where would you rate yourself on a scale of 1 to 10, thinking about the most serious issue that you're having?
Oh, well, Miss Lovett, I think using that scale or the scale from 1 to 10, I would think I'm about a 6, sort of in the middle.
Okay.
I do read a lot. I do get a lot of information from Google.
Okay.
I get health magazines, consumers reports on telling me medicines that I can take and that I should not take at my age. So I try to stay focused on what I can do to help myself. But like I said, I am not a doctor and I cannot doctor on myself. So I would say that I'm between 5 and 6.
Okay, and that's correct. You are correct by sharing that that would be right in the middle. And I would agree with you that if you are feeling that you're about a 5 or 6, that would be somewhere in the middle. And so we can kind of work and grow towards, okay, so now what would be maybe our next steps to move past a 5 and a 6 to reduce your anxiety level. That's what our focus would be, is to help you to reduce your anxiety level. I want you to just think about some of the things that you said and what I'm hearing, and tell me if I'm correct, that your biggest concern is not being able to see the doctor. So when you talk about your physician that you've had for over 30 plus years, and that they were not able to assist you or respond to your calls during that time, and you were leaving and traveling to go abroad, is it any way that you could consider maybe giving the doctor or the doctor's nurse another call, or maybe leaving a voicemail perhaps, and say, I know that, we have been in some different times and that everyone's schedules and lives and everything is kind of changed, dramatically. And if you could just document that day that you call, that you left maybe another voicemail if you didn't get a chance to speak to the nurse. And if you are willing to give the doctor another chance, let's maybe start there. If you could think about calling the doctor back up, maybe if you can't contact them directly, maybe perhaps leaving them a voicemail, and then maybe we can start this again, and then you can see if now maybe the schedules or the doctors or their nurses are able to respond to you, and then you can get that direct communication that you're looking for. Because if what I'm hearing is that you're feeling kind of left out, okay, and it is a concern for your age, and you're feeling left out, and you want to be medically, professionally attended to. Is that correct? Is that about says what your anxiety is?
I agree with you 100%. I feel left out.
Okay.
I feel not connected. And let me share this with you, Miss Lovett. This doctor that I have, I was one of her first patients.
Okay.
I've been at that particular clinic over 50 years. Her daddy was my doctor. He has even done surgery on me. And this particular doctor finished her meds, passed the bar, and became a young doctor and came to the clinic where her daddy was working.
Okay.
I transferred over to her, and my husband and I were one or some of her first patients. I've been with her all of those years. And I guess one reason I'm so angry and upset for her to just tell me at my last visit, see me in a year. Well, I complained about that, and I went back and I told her nurse, I just don't understand. The doctor said, I'll see you in a year. And she says, well, maybe that means you've gotten better, or you don't have the conditions that you want to have, or you don't need the medications anymore. Well, I didn't like that, because to me, I thought that was sort of a rude answer. And what I've really been thinking about, Miss Lovett, is calling the hospital administrator. But at this time, with this pandemic that we have going on, I don't know if this is the correct time to call, because I know no one wants to contract the virus from their patients. So that's one of the reasons I realize they're not seeing patients. But in my conditions, I really need medical help. I will take your advice. I will call the doctor's office. It is a month. A month has gone by, and see if they have loosened some of their procedures about seeing patients. Okay. Maybe I can get in at this time.
Okay.
Okay, and that's why I feel like talking to you is very soothing, because it helps me.
Okay. Well, I'm glad to hear that. Okay. All right. Is there anything else that you want to share? If I could just, get ready to explain to you how we're going to do a simple review that kind of help you out a little bit. If you didn't have anything else that you wanted to talk about today, Mary?
Well, no, I think I've shared everything with you that I wanted to share, and I'm ready to look forward to our next meeting, Miss Lovett.
Okay, all right. So today we talked about you being concerned with all of your anxieties. We used a scale, and that's called the scaling, and so moving forward in our future meetings, we can always go back to using our scaling. It'll kind of help give us a clear picture of maybe how you're feeling or what your emotions are, so that we could either help you to move closer to the positive end, which would be the 10, and to kind of, I know that you're in the middle, but we want to progress, so we want to show progress. Okay. And we and so we use scaling, and so we kind of talked a little bit about these anxieties. We prioritized what you felt that was your highest level of anxiety, that what was concerning you most, and that was not being able to get to that doctor. But we did have an agreement. I suggested that you call back to your doctor, try to get an appointment, perhaps maybe give them another try. Be patient. I understand that at your age it's very concerning. You did say that you don't want to do self-medication, but you do read, and I really like that about you, that you kind of read on your own to keep yourself informed. However, you want your diagnosis to be from a professional, a medical professional. And I totally agree with you on that. So if you would just, kindly make sure, put the call in, be patient. I know everybody's schedule is busy. And then hopefully your doctor, at our next meeting, you'll be able to share that good news with me, that you were able to get in touch with your doctor. And maybe you all could set up a video, a conference call, or I know you said that maybe you might not want to do it that way, but that might be the way that you have to do that until we can, get through our pandemic.
Well,
Yeah.
Miss Lovett, I want to say to you, that seems to be what all the younger people are doing, but I really would have to get someone to help me
Sure.
with that because I don't know how to even use the computer. I have just
Okay.
tuned all of that out, and maybe I could get my grandson
Oh,
to
good.
help me with that, and
Good.
maybe I could do something like that.
Good. Okay.
Yeah.
All righty.
Well, this session has been very refreshing.
Well, very good, very good. And I'm so happy to hear you to be speaking positive, and hopefully you get that doctor's appointment in and get your grandson to help you with your video call or your conference call, and then maybe you can even feel less stressed or full of anxiety. And so I want to thank you, Mary, for this session, and our next appointment, please, I hope you have that good news ready for me when you come in, and I again see you smiling, and I want to say thank you for coming today, and that concludes our session. Thank you.
Well, thank you, Miss Lovett.
All righty.